Change today in the state's travel order rewards Massachusetts residents who've received their vaccines. And here to answer your questions is Dr. Daniel Karitzkis, Chief of Infectious Diseases at Brigham and Women's Hospital. Thanks for being here.
You're welcome. Glad to join you.
All right, so under these revised rules, the state will no longer require people who are fully vaccinated to provide that negative COVID test, quarantine for 14 days when they enter Massachusetts. What do you think? Is this the right call?
Well, I think it makes sense, but people still need to be careful about where they're traveling, whom they're meeting when they travel, and of course to still be wearing a mask during your travel if you're taking public transportation like a train or an airplane and so forth. It's not a license to travel. I don't think we want to be too loose about where people are going and why they're traveling, but I do think it does make sense. If you're fully vaccinated, you're not going to be at much risk of bringing something back and transmitting it within the state.
That's an interesting point. It's not a license to travel because the CDC is saying it's not going to update its travel warnings until more people are vaccinated. Nationally, that number about 10%. It's the same as here in Massachusetts. Do you feel like the CDC is spot on with that?
I do think they are, and one could think that the state guidance is, in a sense, it's personal guidance, and what the CDC is saying, you know, for the public as a whole. And we still have too many states where there's too much COVID occurring on a daily basis. Too many states, as you just heard from Dr. Fauci, inappropriately relaxing their restrictions on wearing masks. And we don't want to see people importing COVID from one state to another. So the CDC guidance makes great sense still.
And so to that point, New York City, I mean, it's just a drive away, and public health officials there are now tracking this homegrown variant they say is spreading pretty quickly. What can you tell us about this, and could it be a threat to Massachusetts?
Well, this is a variant that seems to have arisen in New York. It's now spread throughout the 5 boroughs. It's most concentrated in Manhattan. It's very likely spread further and not yet been detected. We're going to continue seeing these new variants emerge. That's why it's so important that people be wearing masks and still limiting their contacts outside their households, except for those who are fully vaccinated, because we can prevent these variants from emerging and from spreading by all the old-fashioned methods for controlling the epidemic.
Right. Right. All right. While we have you, I want to get your perspective. We've been talking to you for almost a year now. It was today, a year ago, Governor Baker declared that state of emergency. As an expert in infectious diseases, what was going through your mind at that point?
Yeah, it was a scary time. We had no idea what we were about to get into. I think it was clear that this was going to require sacrifice on many people's part, on all of our parts really, and that it would require enormous coordination between state and local government and the federal government, healthcare workers, industry, and that it was a scary time, I have to say.
Yeah. Yeah, and working together, we're getting through it. All right, Dr. Karitzkis, thank you for your time over this last year. We truly appreciate your work. Everybody at Brigham and Women's, thank you.
My pleasure.